Hello. You are about to observe the procedure of delivering a deep TMS treatment. In this video, we will outline the proper protocol for operating the Brainsway Deep TMS system for the treatment of major depressive disorder. Deep TMS therapy works by applying a magnetic field to non-invasively stimulate the brain, specifically the reward centers associated with depression. The unique design of the H1 coil enables the device to stimulate broader and deeper neuronal pathways. Deep TMS is well tolerated and has been shown to be effective for patients who have not responded well to other treatments. The Deep TMS system consists of a number of components. 1. Brainsway's helmet, which includes the Deep TMS H1 coil, represents the state-of-the-art in TMS coil technology. Brainsway's patented Deep TMS coils are uniquely designed to reach a variety of neuronal targets. The H1 coil targets areas required for depression treatment. Brainsway's unique helmets are designed to ensure that the coil is positioned accurately and precisely on the head to avoid missing important depression targets. 2. The stimulator. 3. The touchscreen through which you operate the system. 4. The cooling system. The Deep TMS system's performance capabilities are complemented by a dynamic cooling system which maintains ambient temperature in the helmet during the treatment. 5. The positioning unit and arm. 6. Foot pedal. Use a chair that doesn't have wheels so it won't move during the treatment. Position the chair about 2 feet in front of the system. Make sure the patient is seated comfortably in the chair. Ask the patient to remove any metallic items above the neck, including hairpins, clips, and earrings. Have the patient insert earplugs and ensure that they are properly positioned. Please note throughout this instructional video, all orientations are given from the perspective of the patient. Anytime instructions are given to place something on the right or left-hand side, it should therefore be understood as in reference to the patient's orientation. Prepare the personal cap kit for the patient, which contains a blue cap, a chin strap, and black and red rulers. The cap serves 3 purposes: hygiene, navigation, and to ensure that the helmet sits securely on the patient's head. To properly place the cap, slide it over the patient's head and secure the front so that it is positioned over the forehead just above the eyebrows. The cap's red-stitched midline should be aligned along the midline of the patient's head. Pull the cap down so that it is snug on the patient's head and stretch the back straps up and across the back of the head. Fasten the straps onto the back of the cap using the Velcro. Now pull the cap's ear covers down, stretching the cap firmly around the patient's head and attach the chin strap from one ear over to the other. At this point, you will attach the black flexible midline ruler across the cap, placing it directly to the right of the cap's red midline marker. Position the 0 mark of the ruler at the patient's nasion, which is the junction of the nasal bone and forehead. Locate the patient's inion, the most prominent bony projection at the back of the head, and note its location on the black midline ruler. Now, for attaching the red flexible ruler, calculate 40% of the distance between the nasion and the inion, or use the table on the quick guide. Now, attach the red flexible ruler. The 0 mark of the red ruler should be on the patient's left side. The 25 centimeter point should lie across the red line of the cap. The placement at the 40% distance should take into account the width of the red ruler. Turn on the stimulator by pressing the main power button on the back of the device. Next, press the black on and off button on the front of the device. Activate the stimulator in single pulse mode. Set the stimulator output to to an initial value of 50%. Charge the system by pressing the green button. Once charged, the system's status indication will change from stopped to ready and from red to green. Once the cap is securely fastened on the patient, you can start the determination of the motor threshold. The process of finding the motor threshold will serve us for two main purposes. 1. Finding the exact treatment location. 2. Determining the personal treatment intensity. In order to find the motor threshold, we will first locate the exact position of the motor cortex. Position the patient with the right hand in a relaxed position so that any finger movement is easy to notice. The hand should not be tensed and the patient should sit in a loose, comfortable position with both legs resting on the floor. Position the front end of the helmet at 7 centimeters on the black midline ruler and make sure the helmet is kept straight and level. During the procedure, make sure to line up the 0 point on the helmet with the cap's midline. Shift the helmet 2 centimeters to the right. Ensure the coil cover at the front of the helmet still meets the black midline ruler at 7 centimeters and the 0 mark on the helmet remains positioned at the cap's midline. This positions the helmet directly above the expected location of the motor cortex. Make sure that sufficient pressure is applied with your hands on the helmet in order to maintain good attachment of the H1 coil onto the head. Press the yellow button or the foot pedal to apply a single pulse. Keep in mind that at this point, we are searching for the strongest involuntary motor reaction in the patient's right hand. Apply 2 single pulses with at least a 5-second delay between them. Rate any finger movement in the patient's right hand from 0 to 5, with 0 representing no movement and 5 representing a vigorous movement of any finger. If no motor reaction is detected, increase the stimulator intensity in steps of 5% until a response is observed and up to a maximum of 75% of stimulator intensity. Once a motor response is observed in the starting location, you will begin to search for the position of the motor cortex without changing the stimulator intensity. To do so, move the helmet 1 centimeter forward over the anterior-posterior axis and apply 2 single pulses with a 5 seconds delay between them. Rate the response at this position and continue moving the helmet 1 centimeter forward. Apply 2 single pulses and compare the average response to that observed at the previous locations. If you notice a stronger response, continue moving the helmet in 1 centimeter steps forward and assess if the motor response continues to increase. If the motor response starts to decrease, return the coil to the starting position and repeat the procedure by moving the coil in the opposite direction, in other words, backwards in steps of 1 centimeter. Find the largest response over the 2 directional searches and place the coil at that location. Now repeat the same procedure of 1 centimeter movements over the lateral medial axis. Search for the maximal response along this axis. You have now located the patient's motor cortex. Place the coil at this location. Please make sure to record this location for subsequent treatment sessions. Now we are ready to determine the value of the motor threshold. At the selected stimulator intensity, administer 6 single pulses to the motor cortex with 5 seconds between each pulse. Note any finger movement in the right hand. If a response is observed in at least 3 out of 6 pulses, decrease the stimulator output by 1% until a response is observed in fewer than 3 out of 6 pulses. The lowest stimulator output level at which a response is observed in at least 3 pulses is defined as the motor threshold. Record the value of the motor threshold for future treatments. It is recommended, however, to repeat this procedure on a weekly basis. The treatment location is defined as 6 centimeters anterior to the previously determined motor cortex location. Move the front edge of the helmet forward 6 centimeters along the black midline ruler, but no further than the level of the eyebrows. Do not make any change to the lateral position. After positioning the coil at the treatment location, record the coordinates, since this will be used for subsequent treatments until the motor threshold is rechecked. Secure the helmet to the patient's head by pulling down on the pad at the back of the helmet. Then, tighten the knob and adjustment cords and fasten the helmet's chin strap. Turn on the cooling system by pushing the button on the front panel of that system. The temperature displayed on the screen must be lower than 14 degrees Celsius or 57 degrees Fahrenheit before treatment can be initiated. Select repetitive mode on the device. At this point, you will need to input the different parameters of the treatment. There are 6 fields to fill: stimulator power intensity, frequency, duration, number of pulses, wait time, and number of trains. Stimulator power intensity. Set this to 120% of the motor threshold, up to a maximum of 84% of stimulator output. Frequency. Set this to 18 Hz. Duration. Set this to 2 seconds. Number of pulses. Should be automatically 36. Wait time. Set this to 20 seconds. Number of trains. Set this to 55. As a final check, verify that the total number of pulses is shown as 1,980. In order to allow the patient to better acclimate to the treatment, we recommend to titrate the treatment power on the initial 3 days of treatment, increasing from 100% on the first day, then 110% on the second day, and finally 120% intensity on the third day and on subsequent days. You are now ready to administer the treatment. Press the green button to charge the system. Let the patient know that the actual treatment is about to begin. Then, start the pulses by pressing the yellow button. Observe the patient during the treatment. At any point, you can stop the treatment by pressing the red button. In the rare event of a seizure, apply standard procedures for seizure management. It's important to make sure your site has seizure management medication and equipment on hand, and appropriate training as a precautionary measure in order to be able to properly deal with this rare occurrence. In the case of excessive patient discomfort or limb movement, stop the treatment. Move the helmet 1 centimeter along the different axis, restart the treatment, and assess whether the situation has improved. Once the treatment is completed, remove the helmet and personal cap, assist in removal of the earplugs, and help the patient out of the treatment chair. If you have any further questions, please consult the IFU. You just finished administering your first Brainsway Deep TMS session. Treat to remission. Leave no patient behind.